Hello everybody. I thought I would, this is Dr. Hart with Nursing with Hart, PhD. I am now on, I posted some videos on TikTok now that I also have on my YouTube channel if you want to check it out. I did a lecture video on bipolar disorder, so that I thought I might do some practice questions on bipolar disorder to follow up with the material that I covered. So this first one is a nurse is caring for a client who's been hospitalized for treatment of bipolar disorder and will be discharged with a prescription for lithium. The nurse's discharge teaching should include information cautioning against which of the following factors that may cause lithium toxicity, and I discussed this and all the signs and symptoms of lithium toxicity and when the client should notify the nurse or the provider of the symptoms they're having so that they are not going to have lithium toxicity. When a client is on lithium, there will be, the doctor will order regular lab draws for lithium levels. Lithium level, therapeutic range or normal range I gave you was 0.6 to 1.2. You might see in your textbooks, you might see 0.8 to 1.3, something like that. It's not going to be that ambiguous. It's going to be obvious in your, at least it should be obvious in your test questions. And one of the test questions I'm going to go over does talk about it, gives you a lithium level, so you have to know that normal range for lithium so that you know what to do and how to answer the test question. Okay, so let's go over these answer choices. The first one is experiencing diarrhea. Number 2, exercising moderately. 3, increasing sodium intake. Or 4, drinking green tea. Okay, so I'm going to give you a second to think about it or pause, and then we'll come back and talk about the answer and the rationales. I'm going to take this opportunity to ask if you are interested in this content. There will be more. If you're enjoying it, getting something out of it, if you would please like, share, and subscribe to my YouTube channel. Okay, we're back. All right, so what you're looking for in this question is you're doing discharge teaching, so you're looking for how would you educate the client on how to identify lithium toxicity so they can notify the provider or notify you. Okay, so the correct answer is number 1, experiencing diarrhea, and I talked about this. Lithium is used to treat the manic stage of bipolar disorder. Toxicity is going to start to occur when lithium blood levels become too high. If the patient has a low sodium level for whatever reason, diarrhea, dehydration, sweating, excessive exercise in hot weather, diuretics, these all will increase the lithium levels in the blood because the kidneys process sodium and lithium in the same way. If the sodium levels fall, the body conserves lithium, causing lithium to rise. Okay, so let's talk about these other answer choices. Exercising moderately, okay? Keyword moderately there. Moderate exercise should not lead to lithium toxicity. Okay? Excessive exercise might, because they're sweating. Okay, if your client is sweating a lot, they are going to lose sodium in the diet, and that's going to affect lithium levels. Okay, number 3, increasing sodium intake. Increasing sodium intake will lead to excretion of lithium and a drop in the lithium levels. Okay, so the sodium and the lithium work against each other. If you have a high level of sodium, you're going to have a low level of lithium. And number 4, drinking green tea. Okay, green tea, black tea can lower lithium levels, making it less effective. It's not going to make the levels too high. Okay, on to the next one. A nurse in the acute care mental health facility is preparing to administer morning medication for a client who has been taking lithium for 2 weeks and has a current lithium level of 1.0 milliequivalents per liter. Which of the following actions should the nurse take? Think about the levels that I just talked about and the levels that I talked about in my lecture on bipolar disorder. If you want to stop this, you can go back and watch that lecture to see what I talked about in there. Okay, so let's go through the answer choices. Number 1, prepare for gastric lavage due to an extremely elevated lithium level. Number 2, administer the morning dose of lithium. Number 3, check the client's medication record to assess whether the client has been refusing her lithium. Or number 4, hold the medication and assess for early manifestations of toxicity. So for this question, you have to know normal range blood level for lithium. And I mentioned 0.6 to 1.2. You may also see 0.8 to 1.3. So, what do you think about lithium level of 1.0? If the normal range is 0.6 to 1.2 or 1.3? All right, I'll give you a second and then we'll come back. Okay, let's come back. All right, let's see if you got this one correct. All right, so lithium level 1.0 milliequivalents per liter is within the normal range for lithium blood levels. Okay, so the patient is not at risk at this time for lithium toxicity. So the correct answer is number 2, administer the morning dose of lithium. Okay, they're safe at this level. Let's go over the other answer choices. Prepare for gastric lavage due to an extremely elevated lithium level. Okay, gastric lavage would be to remove the gastric contents because you're afraid that's like, for example, an overdose. Because you were afraid that there would be lithium toxicity, and that's not true in this case. Based on the client's current level of 1.0, okay, this would not be the correct nursing action. All right. Number 3, check the client's medication record to assess whether the client has been refusing her lithium. Okay, that's not correct. Based on the current lithium level of 1.0. Okay, they're at a normal range, so you don't have to worry. They should be taking their medication, and you should be checking to see if they refused it. But that just has nothing to do with whether or not they refuse their medications. Number 4, hold the medication and assess for early manifestations of lithium toxicity. Okay, so again, lithium level of 1.0 is a normal range. The client is safe and fine. No lithium toxicity risk here, so you don't need to hold the medication. Okay, and as I mentioned, the signs and symptoms for lithium toxicity are fine hand tremors, thirst, mild nausea, and a nurse should always assess to see if these side effects are present. Okay, next one. A nurse is admitting a client who is in the manic phase. Clue, keywords, manic phase of bipolar disorder. The nurse should plan to make which of the following room assignments for the client. Where do you think a client with bipolar disorder in the manic phase should be placed on the unit? Number 1, a private room in a quiet location on the unit. Number 2, a semi-private room with a roommate who has a similar diagnosis. Number 3, a private room close to the nurse's station. Or number 4, a seclusion room until the client's activity level becomes more subdued. Okay? All right, we'll give you a minute to figure out what you think the answer is, and we'll come back. All right, we're back. All right, so where should the client be placed in relation to the unit, the nurse's station, the other clients, if they're in the manic phase of their bipolar disorder? Remember, I talked about in the lecture, someone in the manic phase is going to be hyperactive, not able to sit still, accelerated speech. What else? They're going to be flamboyant dress sometimes, lots of jewelry, makeup. They're going to have flight of ideas. Their ideas are going to be all over the place, thinking about inventions. They're going to be may have grandiosity, where they're telling people, I am the best person. We had a client in the mental health unit that I was in. He was going around telling everyone that he had millions and millions of dollars, and he told everyone, check your bank account because I just transferred $1 million to your account. So that's a form of grandiosity. All right, so this one, what nurse room assignment should be for manic phase? Okay, so number 1 is the correct answer. Private room in a quiet location on the unit. Patient in the manic phase is easily overstimulated by people around them. Okay, private room would help them and have offer them to be able to dim the lights or turn the lights out. Quite often in the mental health unit I was attending, clients had their lights off in their room so that they could just settle down to sleep at night and have a quiet timeout while they're in this phase until the medication hopefully begins to work for them. Okay, let's talk about why the other answer choices are not correct. Okay, so number 2, a semi-private room with a roommate who has a similar diagnosis. Okay, so 2 people in the manic phase or 2 people with bipolar disorder are going to trigger each other. So that's not the ideal situation. Again, you may see something different in the clinical unit in your clinical rotations at the hospitals. But right now, you're trying to get through nursing school. You're trying to pass. Right now, you're in NCLEX world. You're not in the real world here. Okay, so just imagine that you have all the rooms available that you want. You have all, when you're in NCLEX world, you have all the empty rooms that you would ever imagine. You have all the supplies, you have all the orders that you need, you have all the help you need, okay, from the techs or the CNAs. That's NCLEX world, that's not the real world. So here we go. Semi-private room with a roommate, okay, that's not recommended, okay, for a client who is overstimulated because they're going to overstimulate each other. Number 3, a private room close to the nurse's station. So if you have been to a unit, what's going on in the nurse's station? It's noisy, it's crowded, it's loud, there's chairs, people making noises and talking. So that's not going to be good for the client either in the manic phase or their bipolar disorder. And number 4, seclusion room until the client's activity level becomes more subdued. Okay, I'm going to talk briefly about seclusion rooms. Seclusion rooms aren't typically designed for clients who are just being too lousy or too noisy or overstimulated, okay? The seclusion room is generally used when a client is at high risk of suicide, okay? Having high risk suicidal thoughts with a plan, okay? That kind of client is going to be placed in the seclusion room. There in the unit I was in, there were 2 seclusion rooms. They lock from the outside, and then there's a window because they have to be, when they're in there, they have to be assessed 24/7 by a tech or nurse until you receive until the doctor releases that order. Okay, that's a seclusion room, and that would not be used in this case. All right, next one. A nurse in an acute mental health unit is admitting a client who has bipolar disorder. Which of the following findings supports the admitting diagnosis of acute mania? Number 1, the client's spouse reports that client has recently gained weight. Number 2, the client is dressed in all black. 3, the client responds to questions with disorganized speech. 4, the client reports that voices are telling him to write a novel. Okay, and we'll give you a second and come back. Okay, we're back. Okay, and in this case, you are admitting a client with bipolar disorder. How would you be able to determine that what would support their diagnosis of acute mania? Okay, so, and the correct answer is number 3. The client responds to questions with disorganized speech. Okay, this is one of the signs and symptoms I had talked about in the bipolar lecture. Clients who are experiencing acute mania are going to have disorganized, very fast speech. And they're going to have such as a flight of ideas. That's disorganized. It's not organized. It's all over the place. Not able to stay on topic. Okay. Let's look over the other answer choices. The client's spouse reports the client has recently gained weight. Well, the opposite might be true on that. With bipolar disorder, bipolar disorder, acute mania, the client may have lost weight rather than gained weight because they are in a hyperactivity state. They're all over the place, running, walking, constantly pacing. So it's more usual, higher chance that they are going to lose weight rather than gain weight. Okay, number 2, the client is dressed in all black. One of the things I talked about in a bipolar patient you may see is a patient who is dressed in flamboyant dress, lots of makeup, jewelry, and so someone dressed in all black is not fitting that description. Okay, they're going to present with bizarre, uncoordinated dress. Okay, and number 4, the client reports that voices are telling him to write a novel. So if a client is hearing voices, okay, that's going to be closer to a diagnosis of schizophrenia rather than acute mania. And I will cover schizophrenia in one of my lectures, so look out for that. And then I'll have some schizophrenia test questions. So the client who's reporting voices, okay, is not typical of bipolar. That is typical of schizophrenia. All right, next. Nurse is admitting a client who is exhibiting manic behavior. The client reports recent personal stressors, including the loss of her mother and a divorce. Which of the following is the priority nursing action? Okay, so there's some clues in here. So the client has had personal stressors, loss of their mother, and a divorce. I believe I mentioned this in my lecture. If I forgot, I shouldn't. I will say it right now. Patients with bipolar disorder are at a high risk for suicide. Okay, because part of bipolar is depression. So if you have a client in this situation, loss of mother and a divorce, all right, let's think about this. Which answer choice would give you a clue about safety? Okay, and there are things that you should be thinking about at all times when you're answering these test questions. You should be thinking about your ABCs, airway, breathing, circulation. You should be thinking about safety and Maslow's hierarchy of needs. Okay? So safety in any unit is important, especially in a mental health unit. Safety is priority. So the priority nursing action in this case would be preventing self-directed violence. Self-directed violence would be the client attempting to hurt themselves. Okay, so let's look at the other answer choices. Identifying support systems. Yes, at some point you may be helping the client to identify support systems while they're on the unit, but not while they're exhibiting manic behavior and they're going through the loss of the mother and a divorce. Okay, it's not priority. Number 2, assisting the client in identifying coping behaviors. Again, at some point you will be helping the client with this, but it's not the greatest safety risk to the client at this time. And number 3, encouraging self-care. Okay, you will be encouraging self-care because patients with bipolar disorder and depression may not be taking care of their personal hygiene, but personal hygiene in this case is not the priority. All right, next one. This client has major depressive disorder. Okay, client who has major depressive disorder states to the nurse that he and his family would be better off if he were gone. Which of the following is the nurse's priority response? Okay, this one is major depressive disorder, but I threw it in there because it's a good safety question. Okay, you should be able to recognize priority questions and safety questions. Okay. Here are your answer choices. Number 1, do you think Your family would be better off without you. Number 2, are you thinking of harming yourself? Number 3, tell me what is happening right now. And number 4, when did you first start feeling this way? Okay. Okay. So the correct answer is number 2. Are you thinking of harming yourself? You have to ask that question when you have a client. That should be the priority question to ask, to find out whether or not what's the client's intent, whether or not they have a plan on a means, a plan on how to carry the suicidal thoughts out, and how would they, and a means to follow through with it. In other words, and the lethality of the means. In other words, do they have access to a weapon? Okay. Have they written a suicide note? Because those are signs that the client is very serious. If they have written out a suicide note and if they have access to weapons. Okay, so are you thinking of harming yourself is the priority question. Let's go over the other answer choices. Number 1, do you really think your family would be better off without you? That's kind of an intrusive question. It's not therapeutic communication at all. Okay. Number 3, tell me what is happening right now. It's okay for you to ask for a detailed description of the client's thoughts or perceptions, but it's not the priority response right now at this point. And number 4, when did you first start feeling this way? Yes, you are going to obtain a history of the client's current state, but this, again, is not the priority response. All right, next one. A nurse is preparing to teach a client about his prescription of lithium for the treatment of bipolar disorder. Which of the following statements should the nurse include in the teaching? Okay, again, nurse teaching, patient education about lithium. All right, answer choice is number 1, you'll need to consume a low-salt diet while on this medication. Number 2, you will need your blood levels drawn weekly during the first month. Number 3, you'll need to take this medication on an empty stomach. And number 4, you'll need to stop this medication if you experience diarrhea. So this is similar to the other question. Okay, so we'll give you a minute to think about this one. Okay, we're back. All right, and so the correct answer is okay, correct answer is number 4. You will need to stop this medication if you experience diarrhea. And so we talked about the signs and symptoms of lithium toxicity and what can cause lithium toxicity. Diarrhea was one of them. Okay, diuretics, nausea, vomiting especially. Anything that's decreasing the sodium levels in the body. Okay, and diarrhea, dehydration, excessive sweating, excessive exercising, those are going to have a sodium loss in the body, and that's going to disrupt, that's going to cause more lithium in the blood. Okay, so let's look over these other answer choices. Number 1, you'll need to consume a low salt diet while on this medication. Okay, so we're not recommending a low salt diet, we're recommending an adequate amount of salt and fluids. Number 2, you will need your blood levels drawn weekly during the first month. That's incorrect. The client will typically have serum lithium levels measured at least 2 times a week until the level stabilizes, and then every 2 months. Okay, or whatever the doctor orders. Number 3, you'll need to take this medication on an empty stomach. That's incorrect. The nurse should recommend the client take lithium with food or milk to prevent the gastrointestinal irritation. All right, next one. A nurse is caring for a client who has bipolar disorder. The client states, "I feel like Superman. I can do anything. I can fly home today and then become a U.S. Senator." Which of the following findings is this client exhibiting? Okay, first off, if you have a client, you may have a client who's saying these things. Okay, you are going to, as the nurse, you are going to respect the client. You are going to not show disrespect or bias towards any client. Okay. You may have thoughts. Thoughts are fine, but you're not going to express your thoughts in this situation. Okay, so what findings is the client exhibiting in this case? Answer choices: number 1, flight of ideas; number 2, grandiosity; number 3, reality testing; or number 4, derealization. Okay, we'll give you a second and we'll come back. Okay, and the correct answer on this one is number 2. Grandiosity refers to the client's belief that he has special abilities or great powers. That's grandiose or grandiosity, okay? So that's what the client is exhibiting. Let's look over the other answer choices. Number 1, flight of ideas. Okay, this is the continuous rapid speech, which changes quickly from topic to topic. Number 3, reality testing. Okay, the reality testing is the client's ability to recognize and correct alterations in thinking. And number 4, derealization is incorrect. It refers to the client's belief that the environment is unreal or distant. Derealization I'll talk about when I get to somatic disorders. There's some sections on derealization. Okay. That's the feeling that your environment is unreal or distant. All right, next one. A nurse in an acute care mental health facility is admitting a client who reports feeling depressed, sad, moody, and overly anxious. Which of the following is the nurse's assessment priority? Okay, and we know the nursing process. Assessment is always priority. Okay, well, let's go over the answer choices. Number 1, coping abilities. Number 2, support systems. Number 3, suicide risk. And number 4, psychiatric history. All right, we'll give you a second. Okay, we're back. Okay, and hopefully you got this one. This is pretty straightforward to me anyways, but priority is always, if you see an answer that has suicide or anything having to do with it, take another look at that one, because that's in the test questions I've seen or used. Suicide risk is a priority. Okay. So you would do a suicide risk assessment. They're feeling depressed, sad, moody, overly anxious. Okay, let's go over the other answer choices. Number 1, coping abilities. Yes, you're going to look at their coping abilities later on, but you need to assess for suicide first. Number 2, support systems. Yes, you're going to explore the client's support systems. Do they have family members to help them? Do they have friends? Do they have their pastor at the church or church members? But that's not the priority at this point. Okay? And again, number 4, psychiatric history. Yes, you are going to get a psychiatric history during the initial assessment, but it's not the priority at this point. Okay, last one. A nurse is caring for a client who has bipolar disorder and is experiencing acute mania. Remember, acute mania, they're talking fast, they're running around the unit, not able to sit still. The client is doing calisthenics in the client dining room. Sorry. In the client dining room during lunchtime. I'm just picturing the client doing calisthenics because I've seen many mental health clients with the overactivity, hyperactivity. They're, doing push-ups and stuff. So the client here is doing calisthenics in the client dining room during lunchtime instead of eating, which is the following statement should the nurse make. Okay, and this is kind of therapeutic communication a little bit. We're going to go over a little bit of this. All right, so we're going to go over test answer questions. You are already too thin and exercise is not good for you. Go sit down somewhere and eat something. Number 2, please come with me. Here's a milkshake to drink. Number 3, we need you to decide what activities you would do today. And number 4, you will need to leave the dining room right now and go somewhere else to exercise. Okay, so think about therapeutic communication. And think about the kind of food choices that I talked about in the lecture if your client is not able to sit still to eat a full meal. All right, so the correct answer, I'll give you a minute and then we'll come back for the correct answer. All right, correct answer in this case is number 2. Please come with me. Here's a milkshake to drink. Okay, milkshake can be consumed on the run or while the patient's walking around, right? So that's ideal for this patient at this time. Let's go over these other answer choices. Number 1, you are already too thin and exercise is not good for you. Go sit down somewhere and eat something. Okay, so this response is not going to get anyone anywhere at all. Your client is just going to get on the defensive and it's going to start an argument. The nurse should avoid judgments and unwanted advice. Telling the client to sit down. Okay, and eat something is very vague. The client is not able to do this at this time. Okay, they're not able to focus on any activity, including eating right now. Very non-therapeutic, number 1, very non-therapeutic. Okay, number 3, we need you to decide what activities you would do today. Deciding activities while they're in the manic phase, they're running around and they can't concentrate or sit still. No, they're not going to be able to think about activities. Okay, that is not a good idea. That is not therapeutic. Okay, so that's not an appropriate answer. The nurse should be able to redirect the client to more appropriate behaviors, stay consistent in enforcing the client expectations. Okay, so number 4, You'll need to leave the dining room right now and go somewhere else to exercise. No, that's not correct either. Avoid statements that are judgmental, and you're not going to be barking orders. That's not going to accomplish anything for anyone. This statement shows disapproval. This can start up a power struggle with the client. Okay, nurse, as the nurse, you should remain neutral rather than giving advice. Okay, so offering a milkshake or small snacks, snack bars that can be eaten while the client is walking around. Okay, those are ideal in this situation. All right, and that's it. So please like and subscribe if you wish to, if you're getting something out of this content. I will be doing other lectures and other test questions, so keep an eye out, and we'll see you next time. Bye for now.